First tonight, hospital closing. Hundreds of workers at risk of losing their jobs as Memorial Hospital in Pawtucket announces plans to shut its doors.
It's a story we first brought you as breaking news on WPRI.com. The announcement by the hospital's parent company follows tens of millions of dollars in losses at the facility. Eyewitness News reporter Ted Nisi broke this story online and has been gathering details all day long. He joins us now live in studio with what he's learned. Ted?
Mike, Caroline, less than a month ago, Care New England executives were still optimistic a new owner was ready to take over Memorial Hospital and keep it open. But today they said they've run out of options.
It's impossible.
After a decade of financial struggles, Memorial Hospital's owners are pulling the plug. The board of parent company Care New England voting Monday night to close the hospital after a proposed takeover deal fell apart. Incoming Care New England CEO James Finale says Memorial has almost 300 hospital beds, but patient numbers have plummeted.
When you have 15 to 20 patients in the hospital, and that's really what the experience we've had over the last several months, a hospital financially can't survive in that era.
Memorial's struggles are no secret. Documents reviewed by Eyewitness News show the hospital lost more than $16 million in the 9 months ending June 30th. Now the question is how many of the nearly 700 people who work at the hospital will lose their jobs. Finale says some, but not all, will be offered employment at other Care New England facilities.
It's the reaction of the staff that's taking care of patients that we have to be concerned about.
Employees are devastated.
The United Nurses and Allied Professionals represents Memorial workers. Union General Counsel Chris Kalachi says the news came as a shock.
You're talking about a hospital that's been operating in that community for over 100 years, and generations of people have worked there. Generations have gone there for their care, and now it's going to close.
Care New England must now file an application with the State Department of Health to get official permission to close Memorial. So far, there's no timeline for how long that could take or when the hospital will actually close. Coming up new at 6, hospital executives discuss their future plans for Memorial's campus in Pawtucket. For now, I'm Ted Nisi, Eyewitness News.
Ted, thank you. And please stay with Eyewitness News for continuing coverage of Memorial Hospital's closure. Coming up on Eyewitness News at 6, we have team coverage, including reaction from state officials on today's news and what this could mean for patients.
We begin with team coverage at 6 on a story we broke first. Pawtucket's Memorial Hospital closing for good. Word came down shortly after we reported on Eyewitness News at noon that a staff-wide meeting was underway at the hospital. And we've been tracking Memorial's financial difficulties now for years, including last year's plans to close the hospital's birthing center, which drew widespread protest. The owner of Care New England had been trying to sell off the struggling facility. And WPRI.com reporter Ted Nisi was the one to break the news this afternoon. Ted joins us now. What exactly led Care New England to make this move?
Well, Caroline, Mike, Care New England executives tell me the #1 problem at Memorial is how few patients are coming through the doors, with sometimes barely a dozen of its almost 300 beds occupied. That's caused tens of millions of dollars in financial losses that were draining the hospital system's cash, and they say it was creating risks for other Care New England facilities like women and infants. After 123 years serving the Blackstone Valley, Memorial Hospital set to close its doors. Incoming Care New England CEO James Finale says there was no other option once a deal with potential buyer Prime fell through.
We've got 15 to 20 inpatients, and for anyone to think that you can financially afford to keep that open, the community is going elsewhere.
Nearly 700 employees currently work at Memorial, some represented by the United Nurses and Allied Professionals. Union General Counsel Chris Kalachi notes Care New England bought the hospital 4 years ago and says workers partly blame the company for its struggles.
They're devastated because Care New England made quite a few missteps ever since they took that place over. In many respects, we think that they inflicted wounds upon themselves, which resulted in some of the failures over there.
Finale disagrees.
Memorial has been financially stressed for over 10 years, and everybody knows it.
He says Care New England is now looking at other uses for Memorial's nearly 600,000 square foot campus, including primary care or specialty services.
So we're working through over the next couple of weeks what we would remain on the campus or in Pawtucket to serve the needs of that community.
Now, Ted, all of this comes at the same time as Care New England is trying to merge with other hospital partners, which is one of the top hospital groups in Massachusetts. So was that a major decision by shutting this down?
Crucial piece of the puzzle, Mike. I'm told Care New England executives and Partners executives met yesterday so they could discuss this move with Memorial, because Partners has made clear to Care New England they will not take over Care New England until they've disposed of Memorial because of how much money Memorial is losing. Now, I did speak to Care New England executives today, and they are very insistent that the Partners deal is still on track and still going to go through, but there's no timeline right now on when that will happen.
All right, WPRI.com reporter Ted Nesi, thanks so much, Ted. Our in-depth coverage of Memorial Hospital closing continues now with Eyewitness News reporter Eric Halprin.
He just got out of a news conference with the Blackstone Valley Community Healthcare. He joins us now live with new reaction. Eric?
Mike, Blackstone Valley Community Healthcare is another provider here in Pawtucket. Keep in mind, though, it is a primary care facility, not a hospital. And they were already thinking about expanding. I was just talking with officials in that press conference, and they say with their expansion, there could be some employment opportunity for some of the employees that were over at Memorial. And earlier today, I spoke with Governor Raimondo about this closure, and she says her primary concern is jobs. Memorial Hospital employs about 700 people. Some are part-time. Now, with the hospital closing, they're unsure of what the future holds.
It's not a good day for people who work there, and I'm urging Care New England to keep as many folks on as they can in one of their other hospitals.
Care New England's incoming CEO says the company won't be able to replace all 700 of the jobs, but that some of Memorial's employees will likely be able to find jobs at other Care New England facilities like women and infants. The hospital has been under financial pressure for years.
It's not surprising, but it's disappointing, and we have to rally around the community and help folks out.
Partly due to Memorial's problems, Care New England's operations lost nearly $70 million in fiscal year 2016 and is projected to lose nearly $50 million in fiscal 2017. Pawtucket Mayor Donald Grebian released a statement saying he's extremely disappointed in the decision to close. He wrote, in part, "I think closing Memorial could have been avoided rather than giving up on an urban community in the Blackstone Valley. Our community needs are important and should not be dismissed for profit. Memorial Hospital provides access to quality care for our residents and is one of our largest employers." Now, the Rhode Island Department of Health still needs to sign off on Memorial's closure. State Senator Elizabeth Crowley, who represents Pawtucket, tonight called on the Department of Health to reject the closure and put it into receivership. Live in Pawtucket, I'm Eric Halprin, Eyewitness News.
Thank you, Eric, and count on Eyewitness News for continuing coverage of Memorial Hospital's closing, both on air and online on WPRI.com.